Hi, my name is Dr. Selassie. I'm a naturopathic doctor, and today I want to talk to you about joint health. A lot of my patients come to me and they say, "Oh, Dr. Selassie, my bones are hurting. I just feel all this pain in my bones." But today what I want you to understand is that usually when you're complaining of pain, for most people, it's really their joint. And your joint is anywhere in between bones that bend. So this is the vertebrae, and these are the bones, and in between the bones is the joint. And the blue represents the joint space. So where else we have joints are in our elbows, our wrists, our fingers, our knees. Knees often cause a lot of pain. So does hip joints. That often causes a lot of pain. And usually when we're talking about joint pain, we're talking about two different kinds. Number one is degenerative joint disease, and that's just regular wear and tear arthritis. That usually happens to most of us as we age, but it doesn't mean that we can't have pain-free joints for the majority and maybe even all of our lives. The second type of joint pain is called rheumatoid arthritis. That's an autoimmune disease where your immune system gets confused and starts to attack your joints. Okay, but for most of us, we're talking about regular old arthritis from wear and tear of the joint. So how do we prevent joint disease? Number one is nutrition. Nutrition always comes first. If we're eating lots of vegetables and colored pigments, lots of good fats like coconut oil, almonds, avocado, fish oils, we're eating lots of anti-inflammatory foods. So you definitely want to have lots of colors on your plate. You want to have lots of healthy fats, and that's going to be really important to provide nutrition for your joints. And remember that there's actually no blood supply that goes into the joint space, so what you really need to do is pump nutrition in by using movement. So a lot of people are afraid to move their joints, especially if they're pained, if they're feeling pain, because they think that if they move their joint, they're going to irritate it. But actually, that's the only way that nutrition can go into the joint spaces when you move the joints. So like with your knees, you've got to actually walk in order to ungel the high hyaluronic acid, or the synovial fluid, which is the consistency of raw egg between joints. And if you don't move that synovial fluid will gel up and get stiff. And what you've got to do is exercise. And I'm not talking about running a marathon or running on a treadmill or doing the elliptical. I'm talking about nice, easy movement where you can move your joints freely. So things like swimming or walking in nature. Even just shaking your joints is really important so that you can bring circulation into the area. So doing things like this is really important. A third aspect of joint health is definitely supplementation. So I really think that supplementation can really bring you over that hump that needs to get you to cure. With supplementation, you want to take two avenues of approach. The first is anti-inflammatory supplements, so things like fish oils and curcumin. And the second aspect are joint builders, so things like glucosamine chondroitin, hyaluronic acid, and collagen. If you have degenerative joint disease or arthritis due to wear and tear of the joint, you definitely want to have an anti-inflammatory and you want to have a joint builder. So a combination like fish oils and glucosamine chondroitin is a really good one, or curcumin and hyaluronic acid. You want to have one from each category. If it's rheumatoid arthritis, then you definitely want to be careful and not use any of the joint builders and stick to the anti-inflammatories only, like fish oils and curcumin. So that's what I have to say today about joint health. Number one, there's two types. There's regular wear and tear arthritis called degenerative joint disease. There's rheumatoid arthritis, which is an autoimmune process that's happening called rheumatoid arthritis. And you want to combat both of these with one, good nutrition, two, gentle, easy exercise where your joints can move freely, and number three, with supplementation. My name is Dr. Selassie, and I'm a doctor you can talk to. Thank you for listening.